मुझे खुद नहीं पता है, तुम ढूंढो Shroff Eye Centre पे जाके। Go to Shroff Eye Centre. Hi, so I've started a YouTube live directly from here. I'm just checking if it is there, but I'm not sure if that old link will work. But they can just come to the YouTube channel of Shroff Eye Centre and just go to the live post and it will show. Hopefully, Farah, can you check, please? Yeah. Upcoming. No, not upcoming. Does it say now? Go to live. Okay. No, just can you ask Dr. Varshini, anyone to check if there's a live stream going on right now? It won't.
Only come now. Okay. Yeah, it's there.
Then.
Yeah, that's what my daughter confirmed.
Okay, then all faces can be seen now.
Yeah, all faces seen. She says yes.
Okay, great.
But when I put it up on the same old post, then I am only seeing you.
On which one? No, if you see the old post, that's because it will become right now post, I'll hide that. So we'll just...
if I do the earlier one, then only you.
Yeah, but right now all three of us are showing.
Okay. She told me, yes, it's okay. So let's get going.
Yeah? Okay.
Yeah.
Okay. Sorry for that. I do not know what happened because last time we did not have this problem where I've done it exactly the same way. So let me just share. This is the link if anybody wants. I'm just sharing it with you.
Yeah, it's coming.
Yeah. Okay.
Yeah.
Then so what we have discussed is, I'll quickly recap since we've already discussed it. I don't know how many people have watched it and what, but conjunctivitis is the inflammation or infection of the cornea and
conjunctiva.
Of the conjunctiva. I'm so sorry, of the conjunctiva. And this happens if somebody, either it's allergic or it's from a pathogen, like it's an infectious cause. And most common right now that we are seeing is viral. But usually it is viral also, and sometimes it can be bacterial. It is uncommon. Let me quickly reintroduce for everyone's benefit again. We have with us Professor Ritu Arora, who's one of the top cornea specialists in the country, and we have Dr. Varshini Shanker with us, who's one of the best pediatric ophthalmologists around here too. So we are talking about conjunctivitis today, and जिसके भी जो भी questions हैं, they can put it on the YouTube live, and we will keep asking the questions. We will keep asking whatever questions you may have. So let's continue. So conjunctivitis, as we were saying, if we should we just repeat how to prevent conjunctivitis?
Yeah.
Dr.
Important. Maybe Varshini could do that.
Yeah.
So as we were discussing previously, we are having like an epidemic of conjunctivitis right now. Huge number of patients coming into our OPD. So essentially what we want to say is कि if अगर आपको आँख में थोड़ा रेडनेस लग रहा है, थोड़ा इरिटेशन लग रहा है, तो इम्पॉर्टेंट सबसे पहले चीज़ ये है कि आप अपने आप को आइसोलेट करें अपने फैमिली से, बाकी लोगों से. स्टे इन अ रूम, अपना सामान सारा अलग रखिए, हैंडकरचीफ्स वगैरह मत यूज़ करिए. हैंडकरचीफ्स, टॉवल्स, यूज़ टिश्यू पेपर्स और उसको रेगुलरली फेंकते रहिए. अपने पास खूब सारा हैंड सैनिटाइज़र रखिए, और जब भी आप अपने आई को टच करें किसी भी चीज़ के लिए, इरिटेशन की वजह से टच करें, रब करें या आँख में ड्रॉप डालें, उसके बाद अपना हाथ रेगुलरली सैनिटाइज करते रहें. बीच बीच में अपना हाथ धोते रहें, स्पेशली किसी भी चीज़ या किसी भी सरफेस को टच करने से पहले, क्योंकि कंजक्टिवाइटिस मोस्ट इम्पॉर्टेंटली देखने से नहीं फैलता है, just by looking at a person with conjunctivitis, so आपके colleague को conjunctivitis हो, तो क्योंकि ऐसा होता तो all of us would have conjunctivitis. We are seeing so many patients every day, but it doesn't spread by looking at the next person, but only by fomites, which means कि the person who's infected touches their hand and touches a surface, and then the next person who gets infected touches the same surface and then rubs their eyes. So the two most important precautions to take are not to touch the eye and to keep washing the hands very regularly and to stay out of contact with other people, public areas and so on, where it can spread more easily.
So swimming is a good thing, no bad thing. Should anybody be swimming right now or avoiding swimming?
No, I think generally everybody should be avoiding swimming right now, also because of the water. It's been raining so regularly. So swimming pools, unless they are cleaned, they are anyway a source of infection. But with conjunctivitis being like it is, it can spread very fast to all the people who are in the water. So definitely 100% avoid swimming.
I think also what people don't realize, as you said, everything has to be kept separate, almost like COVID precautions. Although this is not COVID, we are not saying it is COVID, but
it is not airborne. It is not airborne, so obviously your precautions are lesser, but it's more by touch. So you need to think about the process.
Yeah,
so if you touch a surface,
don't touch your eyes unnecessarily. If you touch your eyes, you should make sure that you have washed your eyes with soap and water before you touch, or you have sanitized it and also allowed the sanitizer to dry off. ये नहीं कि उसी से वो और injury ना हो जाए sanitizer से. Basically, clean hands. Clean hands are very important, and avoid water, like basically swimming in water bodies, so because that can carry the infection and is another way of spreading. And another way is कि अगर हम बच्चे हैं, हम बच्चों के साथ बेड पे लेट जाते हैं तो उनको कंजंक्टिवाइटिस है तो हमें भी हो जाएगा, या बच्चों के अगर टॉयज हैं या मोबाइल फोन्स हैं, व्हिच वी नो चिल्ड्रन यूज ऑल्दो दे शुडंट. सो इफ दे आर नॉट गोइंग टू टेक केयर कि वो अपनी आईज रब कर रहे हैं, फिर वो छू रहे हैं मोबाइल फोन को, so if that happens then and we also touch it and then we touch our eyes, तो उस रूट से infection spread होगी. So that is what we have to take care of. And contact lens.
Yeah, you said rightly.
Yes,
the contact lens should not be used, and if you are wearing a contact lens, you got conjunctivitis, please throw it, even if it's a monthly disposable and you brought out fresh yesterday, but please throw it, because otherwise you are more prone to get secondary bacterial infections. We are normally not much concerned about the viral because it comes and goes, but it's what we are concerned is secondary bacterial infection. And further, more important point, do not self-medicate yourself. If suppose some relative in your house had conjunctivitis and was given a particular medicine, please don't use the same medicine for yourself, because it may be harmful. And do not use any steroids until unless a doctor has prescribed with some intention.
Actually हमारे साथ बहुत होता है मैम कि हम लोग आते हैं कि आपको हमने सुना है कि हमारे फ्रेंड को हुआ था या कि हमारे फैमिली में हुआ था, तो उनके लिए ये मेडिसिन थी तो हमने भी शुरू कर दिया. तो ये should this be done, like, or this is a very bad
no practice? I will say no, because not necessarily you are having conjunctivitis. कई बार दूसरे आदमी को conjunctivitis नहीं होती, उसको ए पर्टिकुलर मेडिसिन दी जाती है एंड आप सोचते हैं आपको रेडनेस हो गई, सेम टाइम में आपको भी कंजंक्टिवाइटिस हो गई है, सो आप सेम दवाई शुरू कर देते हो. सो और you have a conjunctivitis and the other person did not have a conjunctivitis, so redness can have multiple reasons. So it's always better to consult an ophthalmologist, especially अगर आपके यहाँ आँख के डॉक्टर अवेलेबल है, well and good. अगर नहीं अवेलेबल हैं, so you can always go to maybe a pediatrician or a general practitioner and take the medicine from them, but do not self-medicate and do not use any steroids. That's what's most important.
Yeah, I'd like to add 2 points. Don't use old eye drops lying around in your house, because this is like a super common practice कि पिछली बार किसी को लाल हुआ था, वो दवाई अभी भी पड़ी हुई है तो वो हमने डाल लिया, तो वो बिल्कुल मत करिए. और दूसरी चीज़, केमिस्ट से दवाई मत लीजिए, बिकॉज केमिस्ट सबसे पहले स्टीरॉइड्स ही देते हैं, बिकॉज स्टीरॉइड्स आर इफेक्टिव इन द शॉर्ट टर्म फॉर ऑलमोस्ट एनीथिंग. सो इसलिए प्लीज़ केमिस्ट की दवाई मत लीजिए.
क्योंकि जब लास्ट टाइम कंजंक्टिवाइटिस एपिसोड हुआ था, तो 2 months के बाद 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 2 months के and we saw number of cases where steroids had been given, and which led to the perforation of the corneas. So you can lose your vision if you are given steroids and when it was not needed or not under a proper monitoring. If you're monitored properly with steroids, still okay, that also diluted, but not full strength steroids.
I think the biggest problem is people don't understand. When doctors prescribe steroids, they first see कि आपको जरूरत है या नहीं, और फिर prescribe होता है. ये नहीं होता कि सबको जरूरत पड़ने वाली है, और अगर हमको जरूरत नहीं है और हम ले लेते हैं, then it is going to worsen the condition because steroid is a suppression of the immune response. और हम तभी देते हैं जब हम देखते हैं कि immune response excessive हो रहा है और वो खराब कर रहा है. अब instead of helping, it is being damaging. So which is why it's very important that there's no abuse of steroids. Steroids are not harmful if they are given in the proper dose at the proper time, not and in the proper form. Not आपने ऐसे अपने आप pop कर ली या eyes में डाल दी, that is going to be harmful and counterproductive. So sorry ma'am, you were saying something else?
No. Okay.
So the most important thing, please do not self-medicate. Your chemist is not your ophthalmologist. Please see your ophthalmologist, and if not an ophthalmologist, definitely see your eye doctor before you start medication. And इसके complications क्या है ma'am? If Dr. Varshini or both of you can take up maybe, what are the complications? Like if someone doesn't go, why should, we are saying that 3 से 4 दिन में ये mostly सब में ठीक हो जाता है. So why should someone go to an ophthalmologist?
इसलिए क्योंकि at least the current strain which we have seen, the kind of conjunctivitis people are getting is not very severe. It's mild to moderate, and it's invariably going away in 72 hours. But rarely, or the last time when we saw the conjunctivitis, the strain of the adenovirus which was there, it was giving very severe kind of membranes and pseudomembranes in the eye, जिसमें कि 2 लिड के 2 सर्फेसेस चिपक रहे थे, या आंख में हेमरेज भी हो रहा था उसमें. तो वैसा सिवियर जब कंजंक्टिवाइटिस होता है तो वो कभी कभी कॉर्निया के ऊपर कुछ निशान छोड़ जाता है. तो ये देखा जाता है कि जब कंजंक्टिवाइटिस ठीक हो जाती है, आई वाइट हो जाती है, उसके हफ्ते 10 दिन के बाद पेशेंट आते हैं, कहते हैं कि उनको ब्लरिंग नजर आ रही. क्योंकि वो ब्लरिंग इसलिए होती है क्योंकि कॉर्निया के ऊपर कुछ निशान छोड़े हुए होते हैं, जिसको कि फिर ट्रीट करना पड़ता है. कंजंक्टिवाइटिस तो चली जाती है. इसलिए कंजंक्टिवाइटिस को इतना माइल्ड भी नहीं है, माइल्ड, पर इतना माइल्ड समझना नहीं चाहिए, क्योंकि इट कैन लीड टू डिफरेंट काइंड्स ऑफ कॉम्प्लिकेशंस if not managed correctly.
Are children more susceptible to conjunctivitis? उनको ज्यादा होता है या कुछ ऐसे है डॉक्टर वार्ष्णी?
नहीं, ऐसा कुछ नहीं है कि बच्चे ज़्यादा ससेप्टेबल तो डेफिनेटली ही नहीं है, बट बच्चों की जो बिहेवियर होता है उनके में ज़्यादा स्प्रेड होता है. सो व्हेन दे गो टू स्कूल दे हैव क्लासेस ऑफ 30 to 40 चिल्ड्रन, एंड ऑब्वियसली सारे बच्चे आपस में खेलते हैं, तो किसी एक बच्चे को भी होता है तो इमीडिएटली क्लास में 10-15 को होने के चांसेस बहुत ज़्यादा रहते हैं, बिकॉज ऑब्वियसली वो अपने आई को टच करते हैं. उनके क्लासरूम में इतने सर्फेसेस होते हैं, उनके सारे जो डेस्क होते हैं, दे शेयर ऑल देयर राइटिंग इंस्ट्रूमेंट्स, नोटबुक्स, एवरीथिंग इज अ सरफेस. तो टच करके बाकी सबको होने के चांसेस बहुत हाई चांसेस रहते हैं. तो इसके लिए मोस्ट इम्पॉर्टेंट है कि पेरेंट्स ध्यान रखें कि उनके बच्चे को हल्का भी रेडनेस हो या इवन बुखार हो, बिकॉज इट मे स्टार्ट विद अ माइल्ड फीवर और मलाइज और अ कोल्ड. तो अपने बच्चे को स्कूल ना भेजें उस टाइम पे. और सेम थिंग विद अडल्ट्स कि अगर हल्का सा भी आपको रेडनेस लग रहा है तो घर से काम करें, ऑफिस से ना करें. बच्चे ज़्यादा ससेप्टेबल नहीं हैं, बट क्योंकि बच्चों के बिहेवियर को हम कंट्रोल कर सकते हैं, उनमें स्प्रेड ज़्यादा होता है. और एक बार बच्चे में स्प्रेड होता है, अभी जैसे हमारे क्लिनिक्स में हम कॉमनली देख रहे हैं कि पूरे फैमिलीज आ रहे हैं जो कि इन्फेक्टेड है एट वेरियस स्टेजेस. पहले बच्चे को हुआ, फिर दूसरे बच्चे को हुआ, फिर ग्रैंड पेरेंट्स को हुआ. So therefore it may spread much more commonly within families and among children.
Yeah, क्योंकि they are all staying very close.
Yes.
They're staying close, तो फिर वो sharing के chances ज़्यादा होते हैं. So sometimes it becomes unavoidable.
Yes.
Or if बोलो.
Where you were talking about the mild disease, I'm also seeing कि when we are looking at families, A lot of people are presenting differently. I mean, the child may have gotten a very mild attack and 2 दिन में ठीक हो गया, but then the parent comes with like a much more severe infection with, as you're saying, subconjunctival hemorrhages and severe discharge and a lot of lid edema and swelling is happening. So definitely, जैसे आप mention कर रहे थे, complications के लिए we need to watch out for. जिन
Yes.
patients में ज़्यादा severe हो रहा है उनमें.
Yes. 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 Yes.
How does the phase go conjunctivitis का कि मतलब कैसे start होता है, कैसे end होता है, and कब तक infectious रहता है? अगर हमको हो जाता है conjunctivitis, तो कब तक हम किसी को spread कर सकते हैं?
As long as there is a fluid coming from the eye, watering हो रहा है, you know, so we are infectious because virus is being spread. It is like shed into the tears or the water from in front of the eye. So, and it usually lasts for, let's say, maybe about 3 days, you know. And once the eye is less pink, less watery, then the chance you being infectious goes down. Normally, it peaks on the 3rd day, and from 4th, 5th day onward, it's ebbing. But the current, at least the patients which I have seen, I don't know what Dr. Varshini can describe her experience. It's going away in 3 days. Though it's peaking on the 2nd day, and it's going away also. It's going away very fast. I don't know what you have seen, Dr. Varshini, but my experience lately was this.
No, I've been noticing that it is taking a little longer. So about 5 to 7 days for it to go away. And जब तक वो redness है, जब तक वो discharge है, जब तक वो watering है, जैसे मैम ने बोला, तब तक patient infectious है. So better to be careful at least for a week, especially in children. क्योंकि parents are in a big hurry, I've seen, because children are also having, I think, some semester exams and so on. So they're very worried about missing exams and, studies being hampered and so on. But be cautious. It is important.
Yeah.
If someone, let's say, gets red eyes and they come to us, we give them eye drops. जो भी हम देखते हैं उनको जो करना है नहीं करना है, let's say 2-3 दिन में उनका ठीक हो जाता है. और उनके अगर आई ड्रॉप्स हमने स्टार्ट किए हैं तो उनकी अगर रेडनेस रिजॉल्व हो जाती होती है, सिम्टम्स रिजॉल्व हो जाते हैं अगर 3 दिन में, तो क्या वो दवाइयां अपने आप बंद कर सकते हैं या कर देनी है, या इज दिस राइट, रॉन्ग, व्हाट शुड दे डू?
Yeah, Varshini.
Yeah. So first, I think to answer that, we need to answer ki what is the treatment for a viral conjunctivitis. So essentially, viral conjunctivitis के treatment में जो जो हमने precautions बताए हैं, वही लेने की ज़रूरत है. ज़्यादा medications की ज़रूरत नहीं है, क्योंकि जैसे मैडम ने बोला, it is a self-limiting condition like a viral fever, जो कि अपने आप अपना कोर्स ख़त्म करके ठीक हो जाएगा. So maybe 5 to 7 days, but it will resolve by itself. Most of the treatment जो हम दे रहे हैं वो symptomatic है. So essentially it consists of cold compresses, just means कि बर्फ की सिकाई आंख के comfort के लिए, a lot of lubricating eye drops, antibiotic eye drops to prevent a secondary bacterial infection, and to take all the hygiene precautions as mentioned. Maybe we may give an anti-allergy if there is a lot of itching and discomfort happening. But essentially, more than that, we are not actually treating the condition. We are only preventing a secondary infection. जो viral conjunctivitis है, that will resolve with itself. So the precautions and preventing it from spreading and monitoring for secondary complications is more important.
Someone has asked if we do come in contact with someone with conjunctivitis, तो हमें कितने टाइम में होगा या हमें कब पता चलेगा कि हमको होने वाला है या नहीं होने वाला है?
It depends कि आपकी शेयरिंग कितनी थी इस कंजंक्टिवाइटिस वाले पेशेंट के साथ. अगर आपने दूर दूर से ही मिले हैं, हेलो कराया, देन चांसेस आर प्रीटी मिनिमल. बट अगर आपने थोड़ा हैंडशेक करा है, यू हैव डन सम हगिंग, and so, or maybe you used the same towel or some by mistake the clothes which they were wearing, then chances of you getting a higher, because virus is present on those things. And उस हिसाब से तो we are seeing every day hundreds of conjunctivitis patients, but we've not got conjunctivitis. Just maintaining proper precautions, because at least I see even a normal patient I see, I'm always sanitizing my hand after that. and even sanitizing the place of examination. So it's not like that you met a patient with conjunctivitis and you're going to get conjunctivitis until unless you have shared something with that patient.
There's also another question कि बहुत बार लोग डार्क ग्लासेस पहन के घूम रहे होते हैं कि किसी को कंजंक्टिवाइटिस हो गया तो उनको काले चश्मे पहना दो. तो आई थिंक दैट इज मोर फॉर द कंफर्ट ऑफ द पेशेंट की आईज सेंसिटिव होती हैं थोड़ी उस टाइम पे, तो दर्द कम हो लाइट से, नॉट कि उसको स्प्रेड, इट्स नॉट गोइंग टू मेक अ डिफरेंस इन स्प्रेडिंग.
No, it's not airborne.
इज नॉट एयरबॉर्न, ये हवा से नहीं होता है. So,
Yeah.
But it does provide a reminder not to touch your eyes.
Yeah, that's a good one.
So wearing glasses is a good idea.
Yeah. Where if somebody wears glasses, sunglasses is only, of course, if you're stepping out or if you feel like you're going to remember to not touch your eyes then. So if a child gets it, let's say शाम में शुरू होता है कुछ, can someone do something to prevent it? Like when you know आप किसी के touch में, you've been in close contact with somebody, you think आपके chances बहुत high है conjunctivitis होने के, so what can someone do to prevent it? Like preventive measures तो अब चले गए, they're down the drain, but like अगर, is there any eye drop? Is there any way?
So I think the only thing you can do is wash your hands and not touch your eyes. And sanitize, if they've come to your house or anything like that, sanitize all the surfaces. So just like we used to do in COVID times, you take your sanitizer, wipe down all the surfaces, allow it to dry. There is no medicine to prevent it from spreading. So if you have already been in contact, you've touched your eyes, if you feel you're going to get it, you probably are. So there are no medicines. Most of the eye drops, prophylactic antibiotics are not going to work. As I said, antibiotics really don't have too much of a role.
Yeah, it's a viral infection. It is not
a viral infection.
But we only give antibiotics अगर आपको secondary infection हो जाती है, जो सबको नहीं होती है. 90%, as Dr. Ritu and you said, resolve without any. Mostly they resolve without any.
But इसमें symptoms ज़्यादा होते हैं. कई बार वो foreign body sensation बहुत हो रही होती, कि चुभन हो रही है, कि कुछ आंख में गिर गया है, तो इसलिए हमको lubricants देने पड़ते हैं. So we give them lubricants and antibiotics invariably are given. With the hope that there will be no secondary infection, but actually they don't have much role.
Yeah. And would any home remedies work, like putting some saline wash or washing eyes frequently? Will that help? Because I know a lot of people think कि अगर आँख में खुजली हो रही है, say foreign body sensation, so they'll splash eyes more. But will that actually help?
It's not curative. It's not curative. Washing your eyes may bring some comfort. Like the cold compresses hai, the foreign body sensation hai. So it may just bring comfort. It's only for you, but it's not going to help much in resolution of the situation.
How does one cold compress for the eyes? How do you do cold compress?
Yeah, at home, I just tell them to take ice and put it in some polythene, and just apply it over the lids. Or even if you have some dry ice, lying, you can just apply it over your eyelids for some time, for 10 minutes.
Not directly. All of it has to be not direct contact, especially dry eyes. It has to be through a clean polythene or clean cloth.
Yeah.
So, like you said, we cannot prevent it. Someone's asking that if we have been in touch, but we have not rubbed our eyes, so then hame to nahi hoga na. So
yeah, wash your hands. Wash
your hands as often as possible. Sometimes like you become maniac and that kind of a thing.
Yeah, I think all of us are very maniacal in the OPD where we are continuously sanitizing and washing.
Yes.
Someone's asking the other question also, is it okay to rub your eyes even if you haven't come in contact with anyone with eye flu?
Yeah, wash your hands and rub your eyes.
Generally rub your eyes.
हाथ साफ करके rub करिए, but excessive rubbing, I think as cornea specialists, actually you advise.
That's what I would object to it. We always tell our patients, especially who have allergy, if your eye rubber, then you have a higher chance of getting keratoconus. So don't unduly rub your eyes. But yeah, occasional rubbing is fine.
So is there any food, somebody is asking, which can help prevent conjunctivitis?
No.
There's nothing special you can eat or drink that will change.
No.
खांसी जुकाम के लिए नहीं कर सकते हम prevent. हमें पता ही नहीं है कब होगा, यानी तो आप क्या special खाएंगे, किस time पे खाएंगे. तो अगर ये कई बार लोग are doing some using eye drops on their own which are not alternative medicine, let's say, will that help?
Again, I'm much against the traditional eye medicines or the alternative medicines. I know in villages and other places that sometimes people use honey or even like cow urine, or they use things like trifla, which
Rose
is
water.
age-old remedy. Yeah. So, but please don't use any of those things because they are going to make you more prone to secondary bacterial infection and corneal ulcer. And you may lose your sight due to that. Yeah. You were saying something?
No, I was saying, especially if you get conjunctivitis, it is better right now in this season when it's already a high chance that you're going to get. It's better not to add another irritant to the eye. Like,
Yes.
I know people do it because they believe in it, and it's okay. People can do what they
Yeah.
like. But as ophthalmologists, we do not.
Age-old remedies, but we don't recommend it, and we are completely no to it always.
Yeah, I think essentially people need to understand that the eyes are self-cleansing. So nothing needs to be applied in the eyes in a normal healthy eye unless there is some form of tear deficiency, something which is pathological happening. You don't need to put anything in your eyes.
And some other questions we're getting is makeup we have covered. Can we wear makeup, eye makeup? They have said that agar aapko
We
conjunctivitis.
already said that we don't want any more harm to the ocular surface. So be gentle to the ocular surface, which is already so inflamed and crying, So if you put more eye makeup, more foreign bodies, it's going to be further harmful. And I'm saying again and again because I'm more bothered about corneal ulcers, and corneal ulcers are sight threatening and very difficult to revive your vision. So please prevent the complication of conjunctivitis. We can't prevent conjunctivitis, but we can definitely prevent the complications of conjunctivitis.
And can we get, if someone's saying, can you get threading done? You got conjunctivitis.
We don't want people to go out in public and in public places at all. When you get a threading done, when you go to a beauty parlor, you come in contact with the beautician and the number of other people. They are touching your eyes, they are touching other surfaces, you're touching surfaces. You can just spread it to so many people instantly. So please stay at home while the infection is active, and we want you to isolate yourself even from your family members. Forget other people outside.
Someone's asking, what if the child is very stubborn and refuses to put their eye drops? Dr. Varshini, I think this is for you.
So, जैसे हमने पहले बोला, as it is कोई ट्रीटमेंट की ज़रूरत नहीं है, स्पेशली बच्चों में कंजक्टिवाइटिस यूजुअली काफ़ी माइल्ड ही होता है. जो मेडिसिन हम देते हैं उसका फ्रिक्वेंसी भी हम काफ़ी कम ही देते हैं. सो देर आर एंटीबायोटिक्स जो इफ़ यू अप्लाई ट्वाइस अ डे इट इज़ इनफ, प्लस मिनिमम लुब्रिकेशन एंड क्लीनिंग ऑफ द आईज. So that is about all that is required for a short period of time. So if you can just clean the eyes regularly and follow the other precautions, that should be sufficient.
Someone's asking if an 8-month-old baby has watery eyes and reddishness in the corners, is this conjunctivitis? And what medicine can be given? So I don't think we can tell you what medicine without.
I think you need to come to the clinic so that we can see and advise accordingly.
And an 8-month-old baby, so you should definitely come and show, because such a young child, it's very difficult to say क्या हो रहा है. But इतने छोटे बच्चों में भी सब कुछ हो सकता है. Don't think कि छोटे बच्चों में infection या और चीजें नहीं हो सकती हैं. Irritation, allergy भी हो सकती है इतने छोटे बच्चों में.
This is the same season, so lot of allergic conjunctivitis as well.
So how does one differentiate कि किसी को allergic conjunctivitis हो रहा है या infectious conjunctivitis हो रहा है?
So allergic conjunctivitis, especially children में, it is an annual affair in a lot of children. So it may start at the age of 3 to 4 years. Usually it happens at the onset of allergy season, जो कि February March होता है. जैसे ही winter खत्म हो जाता है तो around Feb March generally बच्चों की आंखें थोड़ी लाल हो जाती हैं. Allergic conjunctivitis में normally discharge ज़्यादा नहीं होता है, itching बहुत ज़्यादा होता है. So थोड़ा रेडनेस और बहुत ज़्यादा आई रबिंग स्टार्ट हो जाता है फरवरी मार्च में, एंड इट इज़ यूजुअली सीजनल एंड 2-3 महीने लास्ट करता है. सो पेरेंट्स आर ऑल्सो अवेयर ऑफ द सिम्टम्स, सो इमीडिएटली नीड्स टू बी टेकन केयर ऑफ. जो इन्फेक्टिव कंजक्टिवाइटिस अभी चल रहा है, मोस्टली इट इज विद रेडनेस, डिस्चार्ज, lot of lid swelling and short lasting.
So basically it's going to be okay. So then another question is, one second, I'm so sorry, I have to read the question. Oh yeah, should you go, can I go to a party if you have conjunctivitis?
It's again the same thing what Dr. Varshini said. We don't want to give conjunctivitis to others. So that's our responsibility. So if I have it, I have it. It's better to isolate myself and not come out in public.
I think that's all the questions we have for now. It's also been 45 minutes. I think you all have another meeting to get to.
Yeah.
Yeah.
No, I
yeah.
also wanted to emphasize the signs of complications. So most of the patients, we are telling them not to come back and review if it goes off in 3 to 4 days, because of course they are infectious. We don't want them to come back into the clinic because of course the risk of spreading it too, even though we take all the precautions. But if any patient, as madam said, after 10 days has some blurring of vision, then they need to come back and report immediately. Also, rarely, especially in small children, we see they do develop some membranes and pseudomembranes which prevent it from resolving as fast as it should. So if you have a lot of lid swelling, hemorrhages, which doesn't seem to be going away in 5 to 6 days, or in some of them it worsens, so there is more watering and so on. So occasionally, just in the OPD, we need to remove these pseudomembranes which form to help it heal faster. So if it is worsening, not improving, or you're noticing any blurring of vision, then please come back and report immediately. Otherwise, if it goes off within the course of the antibiotics, you need not come back to the clinic and review.
तो बेसिकली अगर आपका 3 से 4 दिन में नहीं ठीक हो रहा है, अगर आपको बहुत दर्द हो रहा है excessively, if there is a lot of swelling around your eye, and as you said, कुछ membrane जैसी आपको कुछ परत जैसी दिख रही है, or something which is any
difficulty in opening eyes.
Difficulty in opening eyes, or you are having a lot of blurring vision, and in the next, like, and this is not resolved in 3-4 days after you came to us first, or after it started in 3-4 days में नहीं ठीक होता है, तो आप please definitely go visit a ophthalmologist, चाहे हम हो या जो भी हो, but go.
कई बार ये भी देखा है कि during conjunctivitis the eye has become red and they kept thinking that it was conjunctivitis and it was not conjunctivitis.
Yes.
So that was an important message which Dr. Kamna and Dr. Varshini tried to say, that if after 3 to 4 days of routine, it is not showing sign of any ebbing, please visit an ophthalmologist.
Also that if, as they said, as ma'am both have said, that allergic and they can overlap a lot, the symptoms. तो अपने आप से do not decide कि ये allergic ही होगा या ये होगा. अगर आपको इतनी problem हो रही है, तो please go and show. They are your eyes. They're very important. Even if it's a child, don't think they're malingering. Don't think वो ऐसे ही बोल रहा है या उसको हो रही है. Please जाके दिखा दीजिए. काफी फैल रहा है आजकल, and we'd like everyone to stay safe. We'll be putting up the whole thing, even the previous part which got cut as one continuous. We'll put it up. We'll try put it up all together, or it'll be part 1, part 2. So thank you everyone for joining us. Thank you so much.
Thank you. Thank you.
Thank you.
Thank you.